Hey, everybody, I'm here today for my first in-person interview, and I couldn't be more honored to have the amazing Dr. Summer DelSignore here with me, who is a specialist that treats children with Lyme disease, autism, PANS, PANDAS, autoimmune disease, and more. And if you're struggling with any young child in your life and you can't get the help you need, you have to go check out Dr. Summer. But before we get into what she's doing to help her patients, I want to bring it back and first welcome you, Dr. Summer, and ask you to tell us a little about yourself.
Great. Thank you for having me. I'm glad to be here again from iLab. So I am a board certified pediatric practitioner. I'm a DNP actually. And so the focus there is more health promotion in that model of care. And so I have a private practice in upstate New York, and I treat, primarily children and a small cohort of adults. Started off in Lyme disease, and then that sort of expanded out into things like autoimmune, neuroimmune, PANS, PANDAS, and seeing the connection there. And more recently added congenital tick-borne. So we see that as well.
So can I call you Dr. D? Is that okay?
You can.
Okay, because
yes.
I'm going to mess up your last name, even though you told me it's Dr. DelSignore,
DelSignore.
DelSignore. So let's bring it back a little bit, because I just want to know, who was Dr. Summer as a child and what got you into this industry? Because it's a very controversial, difficult industry with a lack of science in some areas and a lot of people not even believing chronic Lyme exists still. Although we've made progress, there's still a lot of controversy. So how'd you get here?
How did I get here? Well, as a child, if you want to go that far back.
Yes.
I was a very type A child, very organized, always interested in science, how things worked, and didn't really know what I wanted to do until I was about 10 or 11 years old. I haven't shared this story with anyone, but my mother actually had a horrific car accident.
Sorry.
She was hit head on. And I remember that my dad woke up my brother and I in the middle of the night and said, "We need to go to the hospital because you're going to have to say goodbye to your mom." So I went in, and for some reason, I didn't feel like it was her time. And I remember whispering in her ear, "I know you don't look like my mom, but you're going to be okay." And everyone else was just sort of losing their minds around. But I was, in a way, I was kind of fascinated with watching all the providers there kind of put her back together. And for the next few years, she went through rehab to learn how to walk again. She had some pretty traumatic brain injury and a lot of, broken bones. And I was there to help her through that. And it didn't bother me. It just felt like this is where I needed to be. So it was an interesting start. It was never something I thought that I wanted to do until that happened and I had that exposure. And I was just so enamored by the talent that was there as a young child, watching them care for my mom and bring her back to life, essentially. And so that's kind of what got me started and kind of piqued my interest. So it had nothing to do with Lyme. I didn't know about it.
Is it clear in the moment, or is it looking back now clear that that was the beginning of your interest? Or at that time, were you like, hey,
my interest was there. Yeah, it was there at that time. That was the moment.
Wow.
Yeah. So moving forward, I chose more of a nurse practitioner route versus a medical doctor route. I liked that health promotion type of a framework. And it seemed to have a lot of the integrative components in it that I practice today that I believe in. And so that's what kind of took me there.
Can you explain health promotion and what that means?
So rather than the traditional model of medicine where you come in with an illness and you seek a diagnosis for that specific illness, within a nurse practitioner realm, you're looking at that also, but diagnostically, you're looking at how can I further help this person's environment? Where are they socially? What can I do to help heal that whole person? Body, mind, soul, kind of a situation. So it was just more of a holistic approach to medicine. And that seemed to resonate with me at the time.
That idea generally conflicts with traditional medical school. So I'm curious,
Sure.
as you went on and you started to go to college and you get your MD, how is there friction between your core values, which I think are true medical values, versus what you're being taught in school? Because oftentimes they teach you, focus on the one thing, not the whole body.
Right. I mean, there were conflicts along the way. I eventually ended up receiving my DNP. So that kind of kept me on that realm. And I do recall with certain classes, because I graduated from the University of Pennsylvania, and there was a pediatric intensive care program that I attended. Nothing integrative about it at all. Nothing. Because again, you're dealing with acute illness. And, I would mention things like, well, what about a probiotic or, something very basic. And then they would look at me like, what are you talking about? But, so there were some conflicts there, but I still stayed true to those core values and eventually found my way out of the ICU into more of an integrative world and a primary care practice. And then eventually led to more specialty practice within tick-borne illness and then autoimmune encephalopathy, that sort of thing. So it just sort of was this natural progression. I just sort of left things open and said, where am I needed kind of a situation. And then several years ago, opened my own practice.
Okay.
Yeah.
So I'm going to go back a little bit more.
Yes.
When you started working as a primary care doctor, especially for children, did you ever, was this in New York at the time? Where was this? Okay. Did you ever run into any Lyme disease patients? Because Lyme is so prevalent. And what was your knowledge about Lyme from school? And how were you treating these patients at that time?
I was seeing some Lyme patients. The integrative doc that I worked with warned me of it, but it was still new to me. We didn't train in Lyme disease. There was hey, this is a thing, and perhaps a few hours to talk about it, and then it wasn't seen as an issue. But the message that I received pretty clearly from the provider I started working with was, hey, you're in Lyme country. And I didn't understand the gravity of that statement. I'm like, oh, you get a tick bite. Okay, what does CDC say? We'll just treat and we'll go on. And I guess what piqued my interest there was that these kids would come to me with a tick bite. I listened to my intuition. I wasn't looking for bullseyes. I'm looking for symptom and I'm looking for exposure. And I listened to moms and dads and say, something's wrong with my child. So we would start treating. And then I would research, just having that healthy curiosity, and eventually found my way to Dr. Horowitz to train with him. So the practice that I worked in actually was just a few miles away from his practice when he had it in Hyde Park. And so I trained with him and gained enormous amounts of knowledge from that and was reasonably well equipped from there. But not knowing the knowledge that I was gaining from him, not knowing the gravity of that, not knowing, the gift I was given.
So all the stars were aligning.
It was aligning naturally. I didn't even know. Yeah, absolutely.
But even more curiously, when you were doing all this and you said, I would just treat based on symptoms. That's a big no-no in the medical community. We have patients come on the podcast all the time and say, I knew I had Lyme. My doctor knew I had Lyme, but they were afraid to treat me because of the pushback they'd get from the medical community. So you were a brand new doctor. How do you have the courage to just say, you know what, I know it and I'm going to treat it despite poor testing and despite a definitive test?
It was just always doing what's right. And it came down to that. And I was willing to take the heat if I needed to. And again, I trust those intuitions of moms and dads who come in, and I trust my own. And of course, a very in-depth history and physical on those children, and speak to them in a way to say, tell me what's going on, and let's just connect these dots. And so, and it is a clinical diagnosis, so I certainly could back it up, but it was worth it to me to do the right thing, no matter.
And I feel like, foreshadow, I'm going to get to this in a little bit, but now here you are running the Mothers Against Lyme group or participating in that group, Project Lyme, and you've helped a ton of mothers, and you're helping a ton of children. So this is just building up your career.
Right.
Walk us through what it was like meeting Dr. Horowitz, and if you knew who he was at the time, and what it was like to basically mentor under him, because that must have been some kind of an experience with his personality, his knowledge, and his experience treating patients.
Right. And again, at the time, I wasn't as well aware of him as I am now. And I thought, there's just this really charismatic guy who is really excited about what he does. This is cool. I'll go train with him. And it was that casual. Initially, looking back now, I again, like I said, it was a gift. It was truly a gift to me. But, I wasn't intimidated. I was just open to the education, and he was willing to provide that. And I remember when we met, he was very excited that I was treating children and said, you're going to be one of the premier people to treat kids, that there's really no one treating them out there in this area. And that proved to be the case. So
if you could reflect back on your time with Dr. Horowitz, what were some key things you learned from him that you didn't know from your experience as a doctor and from medical school prior to that?
Oh, pretty much all of it, really. So just understanding the nature of tick-borne diseases, not just Lyme, but other co-infections, and how stealthy they can be. and, certainly learning at ways that you have to create sort of this assault on those bugs to prevent them from wiggling out of treatment, whatever that may be. So he, really learned how to stack certain medications, why I would use them, certain herbals, why I would use those, biofilm busters, fibrin nest busters, and connecting the why, connecting all those dots and understanding what it would take to actually heal. And then infusing the, health promotion, more integrative side that I have to say, well, how can I now heal this person? Because we're putting them in kill mode. We're killing all these bugs. What do I do to bring them back? So, yeah.
I feel like your health promotion background complements Dr. Horowitz's approach very well, because you're bridging both worlds together. And I think that's a very unique approach that, generally it's one side or the other. And it's rare to see people so in the middle when it comes to both sides of the spectrum. Now, I believe you also had another mentor, was it Dr. Bock as well, who's another really leader in the Lyme community. So share with us what that was like as well.
Right. Well, Ken Bock, because there's two, right?
Ken Bock, I'm sorry, yes.
Yep. So Ken Bock was more in the autism and autoimmune encephalopathy world. And so that also opened my eyes to that autoimmune state that could be triggered from an infection. And so that was a very different pathway. In fact, I brought more of the tick-borne illness treatment to his practice, and then he was sharing more of the autism and autoimmune encephalopathy. So it was really great to train with both of those titans, as I call them, because they're, at the top of their field at the time. And I just sort of melded both of those worlds together, saying it makes sense, especially with children, that we have this infectious triggered component. We have this autoimmune response that happens. There's a lot of neurological components to that as well. And here we are in the Hudson Valley at the time, and most of these are tick-borne illnesses. And now if we expand that, we're seeing this same type of scenario throughout the country and the world. So,
wow.
Yeah.
So I didn't realize that part about that, Dr. Bock, honestly. So thank you for clarifying that piece.
Of course.
But you're right. You're bringing the autism and autoimmune component. You're bringing the Lyme and tick-borne component, plus your background being this, sort of open-minded approach to the whole body. And that's the skill set you bring now today to your clinic. Walk us through, though, how all that information, all that learning brought you out of the primary care field to open up your own practice to help people.
Right. Well, the career, much like healing, is a little bit of a zigzag, as you go. And I just wanted more knowledge. I wanted more freedom to be able to really focus upon those patients, because they were coming to me, word got out, and they were coming to me, and I was in a primary model, which is 10, 15 minutes.
Yep.
And we had a discussion as a group to say, I can't treat these patients in 10 to 15 minutes, especially the level of acuity that's rising because the word's getting out. So there were talks about expanding in different ways. And eventually, I worked with several specialists for a period of time just to gain more knowledge, and then eventually opened my own. But it was just those healthy questions, those why, asking all those questions and watching the patterns. So like I said, when I started originally treating, it was based on CDC. Before I trained with Horowitz, before I knew, but just intuitively saying these kids need treatment. So I based it upon what I knew, what was out there. But those kids would rebound and come back to me. I'm like, this is not working. Something's not working. So it was just gaining that knowledge, evolving and being curious and being that humble scientist, right? Because we gain a certain level of knowledge, and then you become like the preacher or the politician, and then the ego grows and you're like, I can't, but I try to maintain that level of humble groundedness as a scientist to say, I know a great deal, but there's still more that I need to know. There's still better ways of evolving these treatments. There's going to be something newer out there, and I need to be ahead of the game and understand how to meld that in with treatment, and especially modify it for kids.
Yeah, I mean, you're a lifelong learner at that point.
Right, absolutely.
You have to be humble. You have to recognize you don't know everything, and we're going to continue to learn as we continue to grow and treat more people and learn new things. But I have to imagine now you open up your own practice and you start to see, oh my goodness, this is bigger and deeper and broader than I thought. Walk us through that transition to being the person helping children with Lyme disease and a variety of diseases.
It's surreal. It's surreal. In many cases, you're their last hope. So patients typically at this stage of the game are not coming to me with a fresh tick bite. Or moms are not coming to me with, exposure before having babies. It's usually 10, 15 docs in still, and trying to peel through the data and piece it together and find out where, what's the root cause of this? Is it just tick-borne? Is it tick-borne plus other infections or toxins or molds, or was this a congenital exposure and you just happened to have an additional tick bite that triggered everything? So what is this? So yeah, I know it is. It's a bit surreal. It's a lot of responsibility.
Yeah, and I want to get into some deeper issues now because
Sure.
we walk through your journey to where you are today.
Mm-hmm.
But there's a lot of topics that you bring together that I think nobody else really does in our space.
Mm-hmm.
I mean, the Lyme and autism component, the Lyme and autoimmunity component, the PANDAS, the neuropsychiatric.
Yes.
I had a debate with a doctor just this week on the podcast about what really is root cause medicine. And when people argue we have to get to the root cause, if we treat the Lyme disease and we see that Lyme, the Borrelia burgdorferi, is going down, but the patient is still sick, what's the root cause? And I think sometimes we focus too much on, we need to get to that one thing, but if the patient is still sick, there's other things contributing to that chronic illness. And it could be so many things. So when it comes to autism and it comes to autoimmunity, things like that, what came first, the chicken or the egg? I mean, that's the $1 million question people listening are going to want to know. Does autism make Lyme worse, or can Lyme bring on autism? What's the situation with that?
I think we're talking about a couple of different things there. Okay.
Yes.
So if we, you look at autism, and again, there is no gene specific for autism. There isn't one exposure for autism. It's more of a collection of symptom, right? So it's more of a clinical type of diagnosis. So there has to be something neurologically that happened either in utero when the baby was forming, or an exposure that triggered an autoimmune response. So I'm convinced that most of it is autoimmune related in some way. Now, there is a subset of children that their genetics generally or exposures of the way they develop lined up and they are tap dead center autism and there's nothing else there. And that's a very small percentage. But if you look at the percentage rate, it was 1 in 31, I think, most recently. It's growing, and that's from 2010, when we had solid data collection. I think it's grown by like 200 or 300%. That's an epidemic. Right. And so there's always the root cause, as we say, and I know I kind of cringe at that word too, even though that's what I do, is that there was an insult neurologically, either when that child was developing or post-development, where there were certain things passed and something else triggered them. Right. So I think it's more of an immune dysfunction, generally speaking, triggered by something. And there's no rule that it's one something. And that's what we're always looking for. It could be 5, it could be 10 somethings, right? And so essentially you've got to peel through all of those in a systematic way and determine, what is healthy and what isn't. And then work on healing all of those things and bringing that kid kind of back up online. And then developmentally stepping back and say, okay, now where are we really with them now that we've removed those insults? Where are we truly developmentally without those in the way?
But what I'm hearing is the true genetic autism component, where it's just that, is super rare. It's generally brought on by some of these insults, which is good news for our listeners, because
it's excellent news. Yes.
Children have hope.
Exactly.
And we can do things to help those children, whether it's congenital Lyme disease, whether it's acquired Lyme by a tick bite, whether it's other illnesses or viruses picked up throughout childhood. It could be trauma, right? All these things can contribute, but it's hard to unravel that. And I think that's the component where you need to come in, because these complex cases of children who remain chronically ill, they become hopeless, but they come to you, you provide hope, and you can help them peel back the onion and figure out what's going on. So tell us, what are the common things when you're pulling back that onion that are contributing factors? Obviously, Lyme's could be one of them, but what are some other things you're seeing that contribute to this?
Lyme, definitely one, and the other co-infections, Babesia bartonella primarily, which we know can be passed pretty easily through the placenta. Other things like mold, toxins, heavy metals are a component of it. And then there are other genetic components, genetic SNPs, so enzyme processes that aren't, a genetic syndrome, but those processes are dysfunctional in some way, either from environmental exposure throughout the years that's been passed along, which is more epigenetics. And so those systems aren't quite working right. So it could be something in the methylation system, which is how we uptake and convert B vitamins to support our cells, and or from our nitric oxide pathways, which we all have. It all has to work. And if we have a poor detox system, or we're not converting something appropriately because of a genetic subset of these enzyme processes that aren't working, or exposures that have triggered this pathway or alternative pathway, that's what we see from that perspective.
But I think even with that, when people hear genetics, they think, oh no, my genes are set and that's it, and I'm doomed. That's not the case.
Not
As
at
you're
all.
describing, these things have just things that push it one way or the other.
Right.
And through identifying the patient as a person, you can help push it back to the positive direction instead of the negative direction in a simple way, correct?
Correct, yes. So our environment drives our genetics and how our genetics turn on or off, and it drives those pathways, yes.
Yeah. Tell me more about the autoimmune component as well, because I feel like that's another component that many Lyme patients have. And even that, it's the chicken or egg question, kind of circling back to my big, broad question earlier on. You know, many people have autoimmune conditions and then get Lyme and get really unwell. Or some people get Lyme and then develop autoimmune disease. And we've had people tell us that, hey, there's true autoimmunity. And our guest this week just told us that she calls it autoimmune-ish, and they're different things. But we hear different things from different doctors. So where do you stand on this?
I think that there's always a trigger for autoimmune. I think that our immune system, if nourished appropriately, and if we're not stacking any insults on it, will work as it should. Autoimmune is that alternative pathway. And yes, there are some genetics, like I said, genetic SNPs, that will kind of set us up for more risk. And I compare it to a lot of parents to like the BRCA gene, because everyone's very well of that campaign, right? And that it doesn't mean that you have or are going to have breast cancer, but you're at more risk of it. So same thing with general autoimmune as well. We have genetic SNPs that would make us more vulnerable to those things, but you're not necessarily going to kind of switch over into that autoimmune pathway if you don't have the insult, if that makes sense. So,
it does.
Yeah.
It does.
So I don't think that there is just a natural, oh, here's an autoimmune disease for you. Thank you very much. I think that there's a trigger on some level. And as a clinician, it's our jobs to search for that. And if we haven't figured it out, we need to keep searching for that root versus trying to put someone in a box and say, well, here's your diagnosis.
So I think your answer is it could be both, right? We could be more susceptible to it, and then an insult like a Lyme infection could make it worse. And then I think there's the idea of like this molecular mimicry that we hear a lot about recently, where these bacteria like Lyme will produce proteins that mimic the human body. And then you start attacking the human body thinking it's the pathogen, and then it persists after an infection as well. So I think it's so complex, and it really is both sides of it. So, you know, when you have that, how do you treat this when it's so bidirectional?
So again, you treat those infections and those insults. And then on the nourishment regenerative side, that's the calming down the immune system, getting rid of the inflammation, helping the body to detox and reset itself, focusing heavily on the autonomic nervous system. So most people are in fight and flight. They're in sympathetic nervous system. And I like to describe it as like the wagons have circled, the cells have shut down. They're not letting the bad stuff out, and they're not taking good stuff in because it's in fight or flight. So you have to kind of train that body to say, okay, we've gotten rid of these bugs, these insults. It's time for you to relax. And so I work really hard to shift those kids back into parasympathetic, which is the rest, relax, regenerate side. And that's through, there's so many things. It takes me a long time actually to get them back there. The easy part, and this is, all relative, right? The easy part is treatment. The harder part is to regenerate them and get them back and at the steady state where they're in a health state again.
Yeah, we had Jesse Rubin from Generation Lyme on a couple of months ago. And it was so powerful the way he described it, because he said, I treated the Lyme, I was better from a pathogen standpoint, but I was just still unwell, and I kept relapsing. COVID hit, and I just kept having these problems. He decided to get ketamine therapy. And he said he never realized his whole life how he was dysregulated from his nervous system until he had the ketamine therapy. He goes, I feel normal again. Like, you don't realize when you're stuck in it how unregulated you are. And he's been in a good place ever since, because now he's regulated with his nervous system, and he's able to be more, strong when it comes to these insults, whether it's reinfections, whether it's stress, lack of sleep, all the things that we encounter every day that weaken us. So, I want to get a little bit more detailed about these various components you just described. So starting with the easy part, which I know you're oversimplifying. I know that because you hinted at it. When you treat the pathogens, what are you doing specifically? Herbs, antibiotics, ozone, IVs? Give us some common tools you're using for children to kill the pathogens.
All of those things. So many times if there is an acute case and they're very active with symptom, antibiotic combos will start. Protecting the gut heavily, helping with detox from the very beginning, and stress to the parents that this is just as important as that medication. Because if I wreck your gut and you're not detoxing, I have to pull you off of that regimen. So herbals are also pretty heavy. In fact, I had some blends compounded specifically for the practice for the kids, and they're very strong, and to include biofilm busters and fibrin nest busters, and we make them taste reasonably well, and so that helps. And then other things like ozone therapy, which I do, which helps me. It's almost like having your cake and eating it too. Yeah. Now, there are some tests you have to do to ensure someone's safe to get it, but it can help me kind of modulate and balance the immune system at certain doses, but also help kill off pathogens. So I do use that quite a bit. Additionally, I use SOT therapy. So, more gene silencing therapy where it's kind of sterilizing the bug and the bug can't reproduce. So then it dies off. And we're using certainly things like IVIG as we need it, plasmapheresis to clear them out. I pull out all the stops.
Yeah.
And then recently, the past year, I've integrated IVPRP, which is like TrueDose.
What's that? Can you explain that a little more?
TrueDose is platelet-rich plasma.
Okay.
So essentially what you're doing, it wouldn't be your first line treatment, but you're taking a certain prescribed amount of blood out of the patient based on their size, and you're putting it in a centrifuge to separate the plasma and consolidate the stem cells, growth factor, and platelets. And this really cool reaction happens. When you take the blood out, the body says, oh my goodness, I just lost all of this blood. And it triggers the body to kind of start reproducing platelets and all of those factors. Then you're extracting those platelets and those growth factors, and then you re-inject it. So then the body sees it as brand new, even though it's their own blood.
Wow.
So you're using the body's own systems to heal.
That's great.
And so the platelets essentially are like the conductors in the body. So we know platelets are for coagulation, right? To help clotting so we don't bleed to death, essentially, right? So, but there's so many other things too. They kind of tell other factors within our bodies where to go, where the damage is, and where it would recruit other cells to go and repair. So I use that quite a bit as well.
That's really cool.
Yeah.
We learned something. Thank you for sharing that piece.
Sure.
So I'm going to ask you a question because we hear a lot from people, two different sides with antibiotics. And some people say antibiotics are a fantastic tool and they're needed for Lyme patients. Others say they're a dangerous tool because they decrease a lot of the microbes, whether it's be Lyme or, other things like Bartonella, but it leaves the resistant forms and it puts them into the cyst shape. And then they're harder to get with herbal therapy, and you're making it harder to truly heal. So what are your thoughts on that piece as far as how the bacteria will adapt to things like antibiotics, curl up into a ball, and then be deeper into the system, into your tissues, not in your blood, and make it harder for you to treat?
Right. And I can agree with that if that's all you were using, but I don't. So it's a combination of antibiotics, so intracellular, cell wall, cyst type drugs, plus herbals at the same time, plus biofilm busters, plus fibrin nest busters. So I'm adding everything in a layer. So, if, patients with the practice, there have been several evolutions of that initial intake, and we had to break it up into 4 phases because there's so much information to give these parents for these children to implement and onboard. So it takes 4 phases, 6 weeks spaced to onboard the full recommendations for those kids. And then so it's a full assault.
Yeah.
So you have to. So I can agree. If someone is just using an antibiotic, those bugs will figure out a way to outmaneuver. That's why they're stealthy.
Yeah.
They'll create their own biofilms. They'll burrow into tissues. They're not freely floating in our blood.
Right.
If they couldn't hide, they wouldn't be so difficult to kill.
We spoke to a researcher out of Mount Sinai just a couple of months ago, and she's describing that they put, I'm going to probably butcher the terminology, and I'm sorry, from the research standpoint. I think it's I want to say tracer, but it may not be the right term, where they put you this compound in your body, and it goes and seeks out the bacteria for Lyme. And then they put you through a scanner and they can see where it lights up is where the bacteria is.
Yes.
And she kept finding time and time again that all the bacteria were in the tissue, not the blood, especially in chronic patients. And yet it's harder to get there.
Right.
So a lot of these tests and a lot of these treatments won't penetrate deep into tissue. And it sounds like you're aware of that, which is why you're doing this, I'll call it like assaultive approach that hits all different angles, blood, tissue.
Yes.
The biofilm is going to be a huge component as well because it's hard to penetrate that surface. So, I do want to follow up on the biofilm topic because some people say biofilms are really important. And if you don't bust the biofilm, you're never going to get better.
Right.
And other people say, biofilm are not even real or they're not that big of a deal. Where do you stand with that piece?
No, they're very real. They're very real. Dentistry, if you check with our orthopedic guys, they'll tell you about, biofilms. And we have tests now through places like T-Lab who can show us that there are biofilms in the body. And just, from a pathogen perspective, we know that certain bugs will make their own biofilm. Mycoplasma is one of those, not tick-borne, but opportunist infections, will make their own. So we know that it's a real thing. And it's just the sticky matrix within our bodies that's meant to capture debris, cellular debris. It's there. So it is a thing. We know it. I see it in clinical practice every day that we'll start biofilms with patients and they'll react poorly to it. And that's sort of our litmus to know that something's there.
Is it true, though, that biofilm can form? So if you have different viruses, different bacteria, they can come together, share genetic material, and form a protective layer? Because if so, it's almost like, we're all going to be different. My biofilm is different than your biofilm because I have BART and Lyme and these viruses, and they form this like unknown bug because they join together for evil forces. Is that like an accurate way to describe it?
That is, yeah. And it kind of falls in that whole quorum sensing kind of situation, right? Where they're communicating with each other. Yeah. So absolutely, yes.
And this ties into the whole piece of detoxing, right? Because when you bust those biofilms, oh boy, you're going to have a ton of stuff in your body. And your immune system's going to respond. It's going to be the full fire alarm. So as the immune system's responding, inflammation is rising, you're killing off the things that are coming out of the biofilm. What specific tools, whether it be herbal or otherwise, are you using to help detox and prevent a major herx or flare, which could even be more neuropsychiatric as well? Absolutely. And again, the key is low and slow onboarding with that. The detox component is very important to, pull things out from a binding perspective. I utilize things for lymphatic drainage, really push liver detox, kidney detox. So herbals primarily for those things like, or supplementation like glutathione, NAC, alpha lipoic acid, all the things that are going to hit all phases of liver detox. Things like dandelion root for kidneys and milk thistle and things like that. So non-scary types of things that can be utilized. And then I use some homeopathy type drops that can help us kind of stimulate lymphatics head to toe. And interesting. Yeah. How does that work? Yeah. So just more, there are companies that do make them. One in particular is DesBios, they have a comprehensive detox kit and just certain herbs and homeopathy that will just stimulate certain components in the body, the matrix of lymphatics or the liver or kidneys. So there's a whole kit for that. Wow. So it's kind of interesting the way that those things kind of stimulate that function. Yeah. Years ago I did try it, not understanding it in the very beginning. And I was like, let me just do the full dose of everything. And it was out. Really? Yeah, a little bit, yeah. So I think that, other things that we can use, especially for kids, are Epsom salt baths. We call it their spa days. Yes. Dr. Summer, prescribed me my spa day. I have to get in the red light and I have to do a few minutes of sauna and I have to get in my bath, so those types of things. But no, so you hit head to toe, all organ systems that would be responsible for detox. What's the best physical tool when it comes to detox and lymph, right? People about rebounding, jogging, walking, stretching. Sure. What's your recommendation there for people if they're capable of moving and getting a little bit of movement in to help facilitate through movement? Movement every day. It doesn't matter, really. And for the kids, rebounding's great. Jump on a trampoline and, those sorts of fun things. Yoga and Pilates, things like that, dancing, things that would stretch and stimulate. So it doesn't have to be, anything vigorous. And most of the, kids and patients are walking around with POTS dysautonomia and probably wouldn't tolerate that anyway. I'll start with sometimes a little bit of infrared sauna. And just say 10 minutes, just enough to kind of get things moving. So it can be more of a low and gentle movement, but still moving every day. Yeah. In whatever way you possibly can would be beneficial. So let's talk more about children specifically, because a pattern Rich and I have observed on Tick Bootcamp is that children, for whatever reason, seem to have, this PANDAS diagnosis as well. Right. And they also have this more rage and neuropsychiatric implication, more so than adults. Not that adults don't have it as well, right, but kids seem to have it more. And I'm always curious, what are your views as towards why? Well, with children, they're still developing. And their blood-brain barrier everyone's blood-brain barrier is open to a degree, but it's more vulnerable up until about age 22, 25. Yeah. And there is more risk of autoantibodies and infections crossing over as a result. And that's why most of those vaccines for kids are related to meningitis prevention. Yeah. Pretty much all of them. So that's why I see that. So we do, and then also having more of an immature immune system, it's quicker
to kind of go haywire and kind of convert over into that other alternative pathway and create these autoantibodies, which can then cross over into the brain and cause all sorts of problems.
Is it harder to reset a child's immune system because it's still developing compared to an adult's?
It depends. It depends upon exposure, when that happened. If it were in utero, the immune system learned an alternative pathway from the very beginning. And it can be very challenging because it didn't know the correct way to begin with, right? If it's a little bit later, it's sometimes a little easier, but it depends upon, again, those epigenetics, those genetic SNPs, their environmental exposures, how many tick-borne infections they've acquired, how many other opportunist infections they've acquired. It depends on the person. So
I also wonder, because as you noted, the blood-brain barrier is more open in youth and it's less open for adults, right? I'm being oversimplifying here.
Right.
But if a child acquires multiple illnesses, Lyme being one of them, and co-infections from a tick bite, and it goes into the brain and they get older and that permeability of the blood-brain barrier now is tighter, is it harder to treat, to penetrate that barrier because now it's closed, but it was open when the infection went to the brain, right? It seems like almost like it's like a double-edged sword, right?
Right. I don't find that to be the case. Again, it's still open. And again, if you have infection, you're going to have inflammation at the blood-brain barrier. So it's going to be a little leaky, as we call it anyway. So they're still going to have that vulnerability that's there. I understand what you're saying, though. It doesn't make sense.
No, your answer made complete sense, though. So no, it's perfect.
Okay.
So, but even more so, can you describe some of the psychiatric symptoms? Because the number one thing we always hear is, I'm not crazy. It's not in my head. And I don't want to admit that I'm psychologically different because of this. But most of us are. Let's be real. And we're not saying it's all in your head. We're not saying children are crazy. But these bacteria, especially when they get into the brain, can cause a lot of psychiatric symptoms, depression, anxiety, OCD, for example, in children, I think is probably common, if you can speak to that as well.
Yes.
But can you just validate everybody listening that those things are directly related from these infections and not just a pure mental illness?
Absolutely, 100%. So we looked at infectious diseases generally and vector-borne, so all tick-borne and other co-infections and other opportunist infections, and then compared those to autoimmune antibodies in the brain and could correlate that with those psychiatric symptoms, if you want to call it that, right? OCD, anxiety, intrusive thoughts, hallucinations, both visual and auditory in nature, rage, impulsivity, all of it. And we could correlate most of that with those autoantibodies and those infections. And that's where we kind of make the link of that infectious triggered autoimmune encephalopathy and the crossover with what appears to be autism with some of those symptoms too. They all cross. So if you've got this inflammation in the brain, you're blocking certain neuroreceptors. So you can't transmit all those good neurotransmitters like dopamine and serotonin and epinephrine, all those things that kind of keep us balanced. If we didn't have the appropriate amount of dopamine, we would all be impulsive. We would all say, oh, what would that do if I touched that? What if I jumped out of this car? All of these really crazy impulsive things. And it really just has to do with how the body can utilize or make a connection with those neurotransmitters. And if you've got something creating inflammation and blocking it, of course you're going to have those symptoms associated. So you've got to approach it biomedically. Now
I'm going to ask you to give us a story of hope. So you treat a lot of patients. If you can share at a general level, obviously you can't reveal any patients, but a story of somebody who walked in and was in a really bad place as a child, and then fast forward when they got to the tail end of their treatment with you, where they were at with their lives and where they were going on to enter adulthood.
Right. That's most of them, honestly. There is one in particular, and I like to reference this patient, and Mom was perfectly happy with me speaking about him. He was congenital. So she had Bartonella babesia and Lyme actively while she was pregnant, being treated, and gave birth to what appeared to be a healthy son. And he was then quickly whisked to the NICU. Hypotonia, he had really bad jaundice, feeding tube, just awful. And by age 3, he was diagnosed with autism. He was nonverbal, wouldn't make eye contact, wouldn't eat. He had a feeding tube because of the sensory, heightened issues that he had. And we found that he had the same infections that Mom did. Started treating him. In fact, he was one of my youngest kids that I put on a dapsone protocol.
Wow.
He was 4. We waited until what was in the literature for safety for DEPS, and we waited until he was 4 to add it on board. The kid is now 8. He is normalized. He's in school, and normalized meaning developmentally on par with his peers. He is speaking, he is engaging, he is playing, he is learning, he is growing. And you would never know that child was carrying the diagnosis of autism at 3.
Wow. So I want to hear the other path that could have went if it weren't for your help to help treat this child. What could have happened if he didn't get the proper, or he or she didn't get the proper intervention? What would have been the worst case scenario with improper care?
Well, in proper care, he would still be nonverbal. He would still be receiving supportive services without any kind of biomedical evaluation investigation with him trapped in his own brain.
Horrible.
Yeah.
Thank God for you. So another patient that we can discuss, because she's been on our podcast, Rich and I have met her in person, and we absolutely love her. And she's actually going to be out here in medical school pretty soon. Yeah. Julia. So Julia was in the quiet epidemic. We actually walked the runway with her in New York City for New York Fashion Week to raise awareness for Lyme disease. And we've had her on the podcast again recently. And she was somebody who was extremely unwell, and they lost all hope. They found you, and they treated with you. And here she is now, advocating in Manhattan on the catwalk. Here she is in a documentary about Lyme disease. And now she's saying, I never want this to happen to anybody else. And she's following in your footsteps. She's going to school to help other people and be a practitioner to help others. So, she had a couple of questions, because it's been quite a few years since she's treated with you. Yes. So I spoke to her this morning, and I have 2 questions to you from her. The first one is, when she first treated with you, it was very hard because there wasn't enough research or science-backed information to make decisions. But as I noted in the beginning, you were brave enough to help her in a way that you knew was right. Have there been advancements there with research and scientific backup to do what you're doing that you just knew was the right thing before there was even science to prove it?
Right. And there is research, but we know there's a lag time with research that's done, evidence-based research in a lab or in cohort studies, and then reaching kind of the table, in hospital settings or office settings. I think that the lag time is about 10 to 20 years, depending upon the research. So I think it's coming. We're not there yet. I still get patients who come to me and whose parents were smart enough to say, hey, my pediatrician said, let's just watch and wait. And immediately, made their way to the office.
Hard no.
Hard no, and said, no, let's go ahead and treat. But the research has come a long way. I think that Julia's story has helped that, because she really took an unfortunate situation and sort of spun that into something really positive to kind of put back out there in the world. And I think that as all of those collective voices come together, it's becoming something that's undeniable.
Yeah.
So, yeah.
Her second question was, how do you bridge the gap when you have a large care team? So when she was treating with you, she wants to know if it's easier now that you might have a doctor like yourself and other doctors that maybe take insurance, maybe don't, a primary care doctor, a neurologist, a rheumatologist, an infectious disease doctor, a cardiologist, all these doctors who have body systems impacted by Lyme disease, but they don't talk to each other. What are some advancements made since Julie's treated with you in that regard? Because I think that's the problem that delays advancements for treatment of patients as well.
Well, I find it hasn't advanced quite that much, unfortunately. We do try. I would recommend that you have a medical home. You have one practitioner who is running the show, one person who is coordinating, who is conducting, and that person is then they're responsible for collecting and coordinating with all the other specialists. Otherwise, you have too many cooks in the kitchen, and it's just more.
Yeah.
You're not getting better quicker. You just have more people in the mix. So I think that that's important. It does happen with certain cases that I have, and it's a beautiful thing to witness when I can have other specialists who are open to chatting with you and other, clinicians who may be in counseling or psychiatric, because many of these children will need some degree of sort of therapy, not because we think they're a psych case, but because there's a lot of trauma associated with that.
Yeah.
So, but having all of those providers on board is a beautiful thing when it happens. It's still a rarity. Yeah. Let's put it that way.
I think
be very honest. It is. It's a rarity to have everyone collaborate together.
Yeah. Rich first brought this up, and I couldn't agree more. I never even thought about it this way, but when people say you have to be your own doctor, that's dangerous, because yes, we have to be educated and aware. but we're not medical professionals. In fact, we're the patient. The patient
Right.
shouldn't be the doctor, even if we're well educated. So, you need a quarterback, as you noted, right? Somebody who's your home base and your hub.
Right.
And you need to be partnering with them to share information and be able to communicate with them. But you can't be the sole person responsible for your own health. And I think that's a really important message. Now, you did touch on, though, a lot of trauma. And that's the one thing I wanted to circle back to from earlier. You gave us a ton of ways you can treat people with the infection.
Right.
You can help rebuild from a detox standpoint and a lymph standpoint. We didn't really touch on too much the nervous system and like the whole Jesse Rubin's discussion about the ketamine, because there are plenty of other ways to address that. People get treated with Lyme. They're stuck in fight or flight. They keep relapsing, especially young children. How do you address that? What are tools you use to help address the nervous system? And when do you fit that in? Because I know from researching you, sequencing is important. Timing is important. When you do things matter. So when do you do those types of tools, and what are those tools?
Right. So when those children, when we can kind of take them from a level 10 down a little bit and they're agreeable, the first order of action is to get treatment on board.
Yep.
And we want to do it in a way that we don't get a lot of resistance and obstinance, because again, a child's willpower is much stronger than an adult's, I will tell you that.
Oh, yeah.
And so we certainly want to kind of bring them down just a little bit and then start to implementing certain things to say the baths are good. Right. Deep breathing is good. And then we kind of advance it to box breathing, where you hold the breath for a few seconds, you let it out for a few seconds. Other things like sauna. I do like sauna with kids, and it can help shift that sympathetic nervous system a little bit. And it's almost, without any action from the child other than just to sit there and maybe listen to some great music and drink their water, Other things I use are vagus stimulators. So there is one that looks like an Apple Watch that goes on your wrist, and it just kind of buzzes. And there are certain programs, but it's stimulating the vagus nerve to help physically kind of push that sympathetic nervous system over into parasympathetic. So there's a couple of things there. And then again, if the kids can, participate, we'll step it up to other things like meditation, try to do some yoga poses, other things like that.
Yeah. And again, just reinforcing that this is not all in their heads or our heads. I think therapy is an important component as well. I mean, what are your thoughts? Because that trauma component is real. And all the tools you just mentioned are great tools to do in the moment. But I think you have to work through those emotions and those feelings, because it's hard to process that when you're so sick and so gaslit throughout the entire process, that you have to work through it to be healthy emotionally, to not relapse.
Right. Absolutely. And I think that validation is very important with those kids to say, yes, we know you have an illness and we're going to help you with it, versus, oh, you're just acting out, or it's a parenting problem, or something to that effect. So first thing is to validate. It could be the worst case scenario, but there's still a sigh of relief from both the parents and even sometimes the kids are like, okay, I know what this is. Yeah. We can deal with this now. And then I think that helping them work through that trauma, because the body hangs on to those traumas, whether we're aware of it or not. And I think having someone on board, a counselor to some degree, someone who's well trusted, even just to start talking through it and helping to guide that child and get them out of that illness bucket, so to speak, is very important to have on board.
So I know you have your own model, and I've read through it as far as your sequencing and your order of operations.
Sure.
But I want to share with you the model Rich and I have come up with based on just observations from interviewing, hundreds of people, speaking to thousands of people over the last 6 years. We call it PARM, and, Italian, right? So it's like Parmesan. So it's prehab. Because many people, we had a gentleman on who went right into the treatment, had major flares and herpes that end up in a wheelchair. So we feel that some patients need, and really all patients need, to rebuild their body a little bit or prehab their body to be ready for the aggressive kill side of things. So we say it's prehab. Then we do the A, which is assist. And really that means assisting the immune system in fighting off the microbes. And that's really the antimicrobials, whether it be antibiotics or herbals. And then the repair. You have damaged your body. And you touched on this as well. You have to repair that damage to bring it back to a normal state, quote unquote. And then the maintenance, which is key, because if you don't maintain your level of health, you're going to relapse. And that maintenance phase is basically a lifelong exercise of just maintaining good health habits, whether it's good sleep, whether it's, a therapist, whether it's, deep breathing exercises with nervous system, it could be supplements and herbs and things like that. But we kind of broke it up into 4 buckets. And I'm curious what your thoughts are on our approach and where they fit and don't fit with your model.
It's very similar to mine, Absolutely. So we do more of a reset protocol, right? And so essentially, it's similar acronym, and it focuses a great deal on removing toxins and eliminating pathogens and supporting gut health, mitochondria, detox pathways, and then also looking at more of a transforming health. So it's doing all of those things. And there are some patients who do come in who are so toxic that we don't start treatment first. We kind of start in a backwards approach to say, we're going to back into this because you're so toxic. You've developed either, severe autonomic disorder or, mast cell, and it doesn't matter what I give you, you're reactive to. So we'll just start some really great detox protocols and kind of gently work our way into it. And we'll start working on the vagus nerve a little bit, and then we'll eventually get to the treatment. Yeah. So it just depends. So I have a general framework of treatment. It touches on all of those things. But everyone comes to me at a different level and in a different phase.
Yeah.
So I meet them where they are. So when people ask me for what's your protocol, well, I have a framework.
Yep.
I don't have a specific cookie cutter protocol.
Yeah, you can't.
I can't. Right? Yeah. It's very individualized.
Yeah.
Yes.
The one thing you made me think about is when you talked about removing toxins, there's just so many toxins in our world. And I think that especially children that you treat are probably, obviously going to be the worst candidates because we have more toxins than ever. And there are different stats. And we've had Jill Carnahan share with us some numbers where there are thousands of new toxins, newly created toxins every year put into our environment. So when you think about microplastics, mold exposure, and just, all these created toxins by the, industry and manufacturing process, how do you help support that? And are you seeing that as being a big trigger to your children patients? And, I just feel like it's something that many people have fear about and say, I'm never going to be able to get better because of the constant exposure to toxins. But I don't believe that. I think it's true that, yes, we have more toxins than ever, but I think with the proper understanding and mindset, we can easily overcome them. So what are your thoughts on that piece?
My thoughts are we're always going to be exposed. If it's not the toxins of today, it'll be the toxins of tomorrow, right? And as long as we fortify our bodies and we're supporting it with the proper diet, the proper sleep, and nourishing our nervous system, helping to detox those things out and getting things moving, the body can heal itself. I do see with children, though, they are very much like a sponge. Bigger surface area to absorb things. Their liver
less clean, right?
Less a little bit, their livers and kidney and detox systems aren't quite fully developed yet. So they're kind of battling that as they're going along. And if they have an exposure early on, that's just that much more difficult for that organ system to mature and function properly. So you have to help that along, absolutely. But those kids are going to be more vulnerable from that perspective. And again, given the amount of toxins that we are seeing, the different types of plastics and the shift from BPA-free to the current ones are actually worse than the other ones. And then, yes, all the chemicals that we see post-COVID kind of is enlightening with a lot of things, and having that infection that's still kind of permeating throughout and wreaking havoc on a lot of people is definitely changing the landscape. And I think that things have changed so quickly just with technology that our bodies haven't had a chance to adapt to it.
Yeah. I can predict the questions we're going to get just knowing all the feedback we get, because many people, and look, I get it. I get when people are really sick and they just have given up hope and they're listening to podcasts like this, they go, but you don't understand. I'm so unique. I have these things and I'm never going to be able to get better. So I just give up. And the one we get a lot is, I have this genetic expression that says I can detox mold. And I have this genetic expression that says I can't, methylate, so I'm never going to get better. So when it comes to mold, because we're always exposed to mold, right? It's something that you can't live in a bubble.
Right.
So, understanding that makes you more vulnerable. Can you speak to the fact that it's not a death sentence and you can overcome that and you can live a healthy life despite all of these things that might be creating an insult on the particular body, that with the proper care and simple tools, we can overcome those things?
Right. And as I've mentioned, the body can heal itself. Yeah. And our genetics are driven by our environmental exposures, and we can control some of that. And then we can fortify in many, many ways to help. And that's changing our diet, changing our habits, changing our thinking processes so that we keep ourselves in keep our minds in more of a nourishing, healing state, which affects our nervous system. And again, I mentioned that sympathetic nervous system. You're closed off to the goodness, and you can't get rid of the bad toxins if you're there. So I think that's the overarching honestly. And I know I'm simplifying it.
No,
I get it for the sake of this, but more looking at those overarching things. If we can fortify ourselves and if we can get rid of those negative thoughts and get that parasympathetic nervous system drumming, you'd be amazed at what could happen.
And they're frameworks, right? So again, you can't give a specific thing because it's different. But if your nervous system is under control, then the body is in a better position to fight off whatever exposure or whatever vulnerability you may have at a broad level. And I think that's really important to know that people can overcome this. So what are your thoughts for the future? I mean, we've made a lot of progress over the last decade. I mean, when we started Tick Boot Camp, 6 years ago, we weren't where we are today. I mean, we've made leaps and bounds. We still have a long way to go. So what are your hopes for the future? And what are your thoughts for the next decade of the Lyme community?
Well, my hope for the future is that legislation catches up. Unfortunately, in my practice and other practices like me, we have to charge for it, right? So it's not covered by insurance because we're spending hours, not 10 minutes. And there's still, unfortunately, a business that has to be, we need to stay in business to be able to do what we do. And the hope is that the legislation catches up and that model changes so that we have more recognition and more spotlight, not just a campaign, for the sake of, just being on the good side of whatever, right? So we definitely want that. And then I think that could certainly help us drive, more research generally speaking, that we are really gaining more treatment regimens and helping with advancing that technology and understanding that. Because there's tons of animal models out there. We have tons of animal models of research. And there's a lot of other practitioners who will just brush it off and say, oh, well, that was just a mouse model. You can't apply that to people, or something to that effect. But I'd like to see more research funds go there. I'd like to see the legislation just make this a mainstay.
Yeah, and I think what's important is anytime we do a post about a celebrity who is, like Justin Timberlake, for example, we saw him last week, and the feedback, whether it be via the comments or the direct messages or the emails we get, is always so negative that I don't have the funds. He has a ton of money. I can't do it. And look, I get it. You get it. You just touched on it. But I think there are tools that people can do and our resources people can do. And it's going to be harder. I'm not saying it won't be, but it will be harder, but they can still get through this with limited resources, unlike Justin Timberlake or unlike some celebrities. But are you hinting at that maybe in the next 10 years, we can have better coverage for doctors like yourself through insurance because it's so desperately needed? And I think that, Dr. Rose always says 60% of Americans have a chronic illness. And with that kind of voice, I feel like it has to change, whether it be the insurance model, and it's going to be slow, but I think that's what your hope is for the future is what I'm hearing. Is that accurate?
It is, absolutely. And I would love to see it focused more on health promotion. Right? And then we could ultimately reduce chronic illness long term if we were looking at it from that level.
My final question for you in this interview is going to be, if I called you tomorrow and said, hey, Dr. Summer, you killed it, which I did. I loved your interview. You blew me away, which you did. But oh my goodness, my 12-year-old niece just got bit by a tick last summer, and now she's really unwell. She's not getting better. She did a short course of doxy. I need you to help her. What can she do in the short term before she can get in to see you? What are some easy things she can do to start helping to move the needle in the right direction before she can get under the care of a specialist like yourself? What would that be? What would that conversation look like for you? Well,
that conversation would be a very quick general background so that I would know what I could give her and what we could do. But it would be looking at things to fortify, certain herbals and things that could be taken just to kind of get things going. And whether, I don't know if I'd want to mention specifics.
Yes, please do.
Oh, you do?
Okay. Yes,
okay.
Yeah.
All right. So again, one of the blends that I have, and then there's others on the market too. So things like cinnamon, clove, oregano oil, cryptolepis, hutania, banderol, Chinese skullcap, and then things like lumbrokinase and stevia and turmeric. All of those things can be given reasonably safely to most patients without knowing major background history, lab work, things like that. And those are things you could certainly start to do to at least start to move the needle a little bit. Tons of detox, with things like glutathione and NAC. I love something called molecular hydrogen. I live on that stuff, and I encourage everyone. And in fact, I give it to all of my congenital like pregnant moms who do come in, they say, hey, I'm concerned.
Yep.
So we bathe people in that, essentially.
Yeah.
So anything that would reduce inflammation and herbs that are proven to have effects against tick-borne illnesses would be good to start.
And I'm so glad because you touched on this the whole interview, which is basically a question we get all the time. Are these things safe for children? Because we talk about it all the time.
They are, yes.
But everything you just said, I mean, you went through the whole list, right? And you said them, yes, they're safe for children.
Absolutely.
So I think that's an important note. So, yes, if you have a child who is bit by a tick or, you want to do some things before you can get into the care of a practitioner,
Correct.
yes, these things are safe to do. So, we're going to have you back on in a year or so to recap all the updates that you're doing. But Dr. Summer, I can't thank you enough for joining us on our Tick Bootcamp podcast. You've given us hope. And I just want to tell everybody listening that if you, again, like in the beginning, if you know somebody who is a child suffering from Lyme disease or a chronic illness, whatever it might be, you need to go see Dr. Summer because you gave the example earlier, which is that patient you described would continue to be nonverbal and be suffering if it weren't for you. And here that patient is today living a normal life. So I think it's so important, and health is the most important thing we have in life. So we want to encourage everybody listening to come check you out if they feel it might be helpful for their situation. And again, thank you for joining our podcast.
Thank you for having me.